Hey, what's up, everybody? Welcome to the Unconventional Therapist Guide to Nothing. My name is Dave, and I'm joined here with my co-host Greg. What's up, Greg?
What's up, Dave?
Uh, Not
We're
much.
both wearing black.
Oh,
I don't know. I don't know what
I
that
mean,
means.
it means just another day for two dudes like us.
Oh, shout out to a personal message. There's this guy, and this is just coming into my head right now. There's this guy, Mike Cabral, who's been listening to us a lot lately. Loves you,
Okay,
Dave. Very interested in your take on the most recent episodes. Actually, he loves. He really enjoyed the Black Panther episode.
nice,
But
nice.
what he was really kind of hit him, and why I bring it up is because he said, I had read The Alchemist in high school, and after listening to you guys talk about The Alchemist, I reread it, and I just wanted to let you guys know that it brought a whole new perspective to it, and it's like blowing his mind right now going through it again. And I love to
Dang,
hear,
that's
you
awesome.
know? Yeah, I love to hear that. So
Well,
that's,
if people will just acknowledge it, we can really blow a lot of people's minds, I think.
I know. It's like, I was like, can you tell your friends?
Yeah.
Tell as many people as you can. So, speaking of podcasts, I did listen to this podcast last year. It was like this bunch of teens. It was in the city, Leroy. I don't know if you've heard of it. I don't think it got too popular, but all there was like 20 or some big number of teens in the same city that started presenting with these weird symptoms, like Tourette-like symptoms, even like tics and just outbursts and all kinds of things like
Yeah.
that. And it's funny because they really never figured out what it was. It's like there's all these like could have been the water. There was like some of course there was a lab around somewhere that people were like, is it from the lab? But there was
There's like the
ma-
smokestacks from like the Simpsons power
yeah,
plant in the
yeah.
background.
Yeah, exactly. Honestly, like that exact kind of thing.
Yeah.
And what it basically came down to was two things that are, you know, wildly misunderstood. And I think those things are mass hysteria and conversion disorder. I mean, specifically today, we're going to be talking about conversion disorder. But I mean, this, you know, the physical manifestations when your body can't handle the stress of something, like converting to, um, physical ailments from
Yeah.
like mental stress. I just find that so fascinating. To me, Dave, like I was having this thought today, and you can tell me what you think about this. It's almost like sometimes people get so stressed out or so depressed or so manic that they slip into psychosis, right? I mean,
Yeah.
or like we've talked about with dissociative identity disorder, where someone gets so their trauma is so heavy that they can't handle it, that they dissociate into their own mind, and then whatever can handle it comes out. Maybe this is a form of dissociation too, where like, something becomes so stressful and so traumatic that they dissociate from
Yeah.
their body, their mind, and it sort of appears in their body, almost like the same idea of like, self-injury, you know?
Yeah. I mean, that thought definitely sort of rings true on the experiences that I've had with this disorder. Um, and most of my experiences, except for more recently, and I'm just gonna say this, like I just recently found out that non-epileptic seizures were also considered a form of conversion disorder. And that actually blew my mind because I was like, oh, okay, so I get what you're trying to say here. Essentially, you're saying that the non-epileptic seizures have no real medical reason for existing, and
Mhm.
it's based on a mental uh what I don't know what the word would be, just some kind of mental
Stressor.
form stressor,
Yeah.
yeah, that's like
Yeah.
it that ends up coming out as the seizure. And that made so much sense to me when that was described. And my other experiences, I worked with a kid, and most of it's like stories I've heard, but or people I've worked with that either were dealing it within a close relationship, or they had previously dealt with it. I had this one teen that I was working with. By the time I was working with him, it was already kind of cured, but he had previously had this like traumatic fall, and he couldn't walk. But there was no medical reason for his inability to walk. It was the something to do with the trauma from the fall. And then just recently, and this is probably the most extreme case I've ever heard. I have a patient who I've been seeing for a very long time. His brother passed away very suddenly, and suddenly his father started to have all these medical issues that there was no actual reason for. like his left arm wouldn't work. It was almost like he thought he had a stroke, but
Yeah,
and he kept
yeah.
falling. This was going on for the span of, I want to say, 2 years that I've been seeing my patient. And actually, just, I want to say 3 weeks ago, his father passed away from the conversion disorders symptoms, leading up to basically his body shutting down because he stopped eating at one point. He was
Yeah.
in a nursing rehab. It just progressed so far. And it was the most frustrating thing for my patient to see his father exhibiting these symptoms that there was no actual reason for. But yet, one of the things that really held true to what we'll describe as for the conversion disorder, the loss of his son, the father's loss of his son, he had also lost a sister somewhat
Yeah.
recently. He never spoke about those losses. He never processed those losses. He just kind of would like, as soon as those losses happened, he suddenly started having these symptoms, and it was like it's almost where he started to channel all of his focus. You know what I mean? It was like,
That's like incredible to me that the symptom. So it's like that, and we'll talk about the it's all in your head. People will say like
yeah,
those kinds of things, faking it when you talk about
right.
the seizures, especially.
And that's the hardest part, I think, about
Yeah,
conversion disorder is for the people surrounding this person. It must be the most
frustrating.
frustrating thing in the
Yeah.
world. I know, just even working with my patient, seeing him, as we were seeing each other biweekly, and actually, I'm not to take credit for it, but I actually was the one who threw out, like, have you talked to his doctors about conversion disorder? Because you're basically telling me they ruled out every medical explanation and there's nothing else left. And yet there's all this trauma going around with the loss, the grief, the unprocessed grief. And he brought it to the doctors, and they uh, kind of started that conversation. And it was so sad to see that he was never able to actually like face the things that he needed to process. And he allowed it to, I don't know. I don't even know if you would say he allowed it, but it progressed to the point where he ended up passing away. Um, so yeah, that conversion disorder is a serious thing, and we're going to talk about it, and kind of what it looks like, and it doesn't always obviously result in something as serious as that. I think there's a
No.
lot of
Look,
degrees of how it could look.
you want to hear another impactful one?
Yes, yeah.
I mean, historically impactful. Most things in the Salem witch trial point to conversion disorder.
I when you were saying the intro part, I almost said, are you going to tell me all the girls in the Salem witch trial were?
That's where most of the research leads right now. It's with conversion disorder. I mean, think about the amount of stress that was going on back then. And if you want to hear more about the amount of stress that was going on back then, Dave and I covered it a while back, and we think we did a pretty
Well,
good
that was a
job.
long time ago. Yeah.
It was a while ago, but it was heavy research on that one. So this kind of idea that like psychological conflicts can turn into physical manifestations and symptoms. This term itself coined by a very special person, Freud. Freud came up with this
Oh,
diagnosis.
okay. All right.
Yeah, which is, of course, right, in a sense. This is the guy that gave us. I mean, he did a lot of strange things, and again, we talked about him in an episode. But he gave us the unconscious. Because of Freud, it's not like just spirits that are controlling our behavior, or like our thoughts are actually coming from us, and we can do something about them. And
Yeah.
he came up with this idea that, hey, look, this physical thing that's going on with you, it could be because of the amount of stress around you. And people must have been like, no,
Yeah.
for so long, right?
Right.
And
Right.
it's just the way it is.
Can you start to get into a little bit of what conversion disorder is?
So yeah, it is, Dave, and like other things, it has a new, more modern name, and that's functional neurological disorder. And this
Also known
term,
as FNDS, I think, right?
yes, yes. So yeah, you gotta have the acronyms too,
Yeah.
just so no one can have a clue, right? I mean, it's crazy that like, what's wrong with conversion disorder? I say it's perfectly named actually, but anyways, it just it's symptoms that involve the neurological slash like nervous system, right? And it can't be explained by any other neurological disease, especially what you're talking about right now. So these diseases or issues, it's like anything. It's like loss of ability to walk, loss of the ability to swallow. In World War One, there were people that were losing their sight. Can you imagine? Like you were talking about paralysis, seizures, all these things that, could these horrible things that could happen to you. And you're like, why? Like, where is this coming from? So
Yeah.
I want to talk a little bit about signs and symptoms of this stuff. And I think it's important to know these things because a lot of the times these have a very medical and a very something that I've always appreciated about psychology and what draws me to it is when you have a physical ailment, they do scans, they do blood tests, and they can point to something. But once they can't do that, it's like that's when we come in, I think, right?
Yes.
Kind of interesting, right?
That's
So,
typically what happens, right? They'll say
y-
you should get a therapist and or you should do CBT. Like
yeah,
a
yeah, yeah.
patient's like, oh, that sounds like I'm going to give them something. And then they come in, they're like, oh, you're just going to talk to me about this thing that has to do
Yeah,
with my
exactly.
thoughts.
No, well, like even now working in the emergency room, I hear it all the time when the doctors will be like, "Oh, we couldn't really find anything. It's anxiety,"
Yeah.
that's what they just kind of like throw that around so much, and maybe, probably,
Right.
but
Right.
still. So signs and symptoms. Here's some of the things that like you might experience, like paralysis, weakness, like you've mentioned, abnormal movements, like the girls from Leroy with the tremors, outbursts, difficulty walking, loss of balance. Here's one that's scary, that I think comes with anxiety a lot. A lump in the throat, like heart being really
Ooh.
difficult to swallow. Have you ever heard like anybody complain about that?
Yes, I have, but not, I didn't like know about it in relation to
Yeah.
this.
So
Yes.
seizures, of course, unresponsiveness, almost like dissociation, which I think makes sense, but like almost like catatonia, something you would see almost in like schizophrenia. So the ones that those are sort of the neurological symptoms, and the other symptoms that might affect your senses are like like neuropathy, so like you don't really feel things, tingling in your hands, speech problems, or losing the ability to speak, or your speech becoming slurred. So that's when you mentioned like, am I having a stroke right
Yeah.
now? You know,
Hmm.
like I mentioned, vision problems or blindness, which is a heavy symptom, right?
Yeah. Of course.
I think that automatically becomes like your chief complaint,
Yep.
right?
Yep.
So, hearing, same deal. Like you can lose your ability to hear, and you can lose your ability to think properly, almost dementia-like symptoms. So memory and concentration are off.
Right.
Dave, I mean, this is from we're saying things like blindness and paralysis
It's,
and
I
going.
know it's serious. Yeah.
I know it's very serious. Is it the most serious? Um, I don't know. Like,
Well, the part of it that really makes it scary is imagine you're starting to feel these symptoms, you're experiencing these symptoms, and then you're told that there is no actual explanation for why those symptoms are happening. I think for the person experiencing the symptoms, that might feel like, what is going on with me? That I think that's where they immediately go to Google and they start
yeah,
Googling, like, what else could be wrong, right? I can only imagine the spiral that must happen. But then
yep,
there's this really interesting thing that happens for some, not all people, obviously, that have conversion disorder, but they may come off almost as if they're not worried about their symptoms. And this
yeah,
is a phenomenon called la belle indifference.
yeah. It's French,
did I
baby. I
did I
like that.
nail that right
You
there? That
nailed
was
that. That was
beautiful.
romantic,
That's French for beautiful ignorance, and that
which is a beautiful
happens
term.
most
It really is.
commonly. Yeah, it really is. It happens most commonly with conversion disorder. But like I said, that's not for everyone. Um, so yeah, that's like kind of an interesting outlook, but I almost wonder if that's like the protective thing because it could be so scary. So if I
It,
over focus or feel like panicked about this, I would probably just have a heart attack because of how scary this feels, right?
yeah, Dave, I got a question for you,
Yeah.
and it does sound an awful lot like something we don't hear too much about. Like maybe when someone like children belly aches and maybe someone who feels something in their body and thinks they're having a heart attack and it's not panic disorder. There's something called somatic symptom disorder. Which is essentially like you're stressed or you're anxious and you have somatic, if you take the word soma, that means body, and you so you feel stressors in your body. Like, how is that different? Is there this that's the same?
No, that is something different. I actually have that.
You do. That's what I'm just.
Okay, all right. So they both fall under the same group of I don't know, of kind of like
Yeah.
symptomatic things. But so there's a lot of overlap here in how they could look, and they also could be happening comorbidly.
Hmm.
So it could be both at the same time. With somatic symptom disorder, you have at least one symptom that severely disrupts or interferes with your life. The causes are usually like spend a lot of time thinking about the symptom, you feel very worried or anxious about your symptom, or you dedicate an unusual amount of time and effort to the symptom in some way. The thing with conversion disorder is that you have a brain related symptom or multiple symptoms, meaning these symptoms keep you from functioning as you how you would under normal circumstances. So how
Oh, I see. I do get that a little bit.
I and that sounds kind of wordy. So let me think if I can find a better way. I feel like with somatic symptoms, it's more about the worry and concern about
Yeah.
or the
I think I
focus on the symptom, while actually with conversion disorder, you're experiencing the symptom. Is that kind of what you're taking from
so
that?
I was thinking kind of like, when someone has like panic disorder and they're like fear they're gonna have a heart attack or just regular like they can be doing something or something can grab their attention and maybe they're like engaged with a friend or like playing like I don't know, like pickleball, something where like it's taking up their attention. They forget about that symptom for a while. With conversion disorder, it's like no, that's like with you. It's like happening, and it's.
Yeah.
I guess I would compare it like anxiety versus post traumatic stress disorder. You know what I mean? Like one's it's like a little bit lighter and
If
more.
somebody were telling me like they had this somatic symptom that their arms didn't work, and then I threw
Yeah,
a ball at them, and then they like immediately reach up and grab the ball before it
yeah,
hits them in the face. That's
yeah.
a little different than with conversion disorder. They probably
It
would
would hit
get
him
hit
in
in
the
the face
face.
with the ball,
Yeah,
right?
exactly. That's a great way to put it. So is that your test that you use?
You throw a ball at them.
It's better than a
No,
knife. I've
no, I'm
seen that.
sorry, that is conversion disorder. No,
I'm sorry.
I'm really
Things are
sorry.
worse. You've got a bruise and uh yeah, that's
Sorry,
I can see
yikes.
that. Yeah.
So who does this affect? This can affect people throughout their life, including even during childhood. Certain symptoms are more likely to happen at different ages. For example, the age range for seizures is 20 to 29 typically, while the average age range for movement related symptoms is between 30 and 39. Why that is, I'm not totally sure. Um,
And
how do
then
you
once you're 40,
diagnose?
Dave, like us, you're just too old for everything.
Yeah, I guess,
Can't even get can't
I
even look
wonder
forward to
if
conversion
it's,
disorder.
it's interesting. I wonder if it's almost like the symptoms would be more related to things you worry about at certain ages, right? Like I was telling you, like that individual's father, he was an older gentleman, and all of his symptoms seem to be like stroke related.
Mhm.
And it's like that is that more of a thing that in like someone over 60 would worry about?
Yeah, like, well, are you saying like,
Probably.
like I'm having these like neurological weird symptoms at 30, and it's more terrifying and causing more anxiety and stress because it's like incongruent with my age in a sense?
I guess because it feels like something that could happen to me,
Yeah.
right?
And if you're like 46 and you like kind of feel like you're having a heart attack, everyone's like, yeah, it could,
I
it's not.
wonder if there's a so we mentioned non-epileptic seizures, and like I said, I actually didn't realize that that was considered part of conversion disorder until somewhat recently. And I wonder if there's actually an increase in non-epileptic seizures and diagnosis that we're seeing with that, because I feel like people are more aware of seizures overall
Mm.
in the last few decades.
Yeah, like it's almost when we talked about concept creep, we're almost like diagnosing this into existence a little bit more. Because you mentioned seeing it, and I saw it, and I have it, David. And you know more about this than I do. What I've been seeing it with, I saw it twice, and both people, and I don't know if this has anything to do with anything. I'm just telling you, like my experience. Both were autistic. Now, does that make sense to you? Is there like because being autistic doesn't like I just doesn't. I don't know. Why would that be? Or is it just a coincidence?
It might be coincidence.
Yeah.
I don't know. I would have to look more into that.
Okay.
I well, one thing, another part of the like the non-epileptic seizures I thought was interesting is so I forever I thought it was like definitely a stress-induced thing,
Hmm.
right? Um, and I have two patients with non-epileptic seizures, and we tend to just associate it with high levels of stress that are going on, and that's going to happen. We were reached out with a listener who actually asked us to do this episode. And I was like, you know what? It's already on the list. We've been meaning to do it. Let's do it. And he has non epileptic seizures. And I asked, are yours stress induced? And he's like, nah, not really. Sometimes if I overdo walking or if I'm a little overstimulated in an environment for too long, I usually have one. So that description kind of makes me think maybe it's stress to the body, actually, or
Hmm.
like fatigue to the body trying to handle certain situations.
Do you think that like with this, not I'm gonna say new, but this the seizures that are happening non-epileptic, would you think that maybe a good approach to that would be the same way you would approach people's mania with bipolar, where it's like let's learn the sort of the conditions when it happens and sort of like what can we do to mitigate that? Like, are you not getting enough sleep? How are you eating? Like kind of like learn like the is almost like kind of figure out what happens before it and start to feel what it feels like before it, and so we kind of like mitigate.
I
Uh,
feel like there's a lot of that understanding that like of self-awareness of
yeah,
like that you would do with a patient working through this. I also want to give a little note that our listener who recommended this episode did actually kind of say conversion disorder is sort of an outdated term,
yeah.
and that we already mentioned the use of
Oh, and
the
here I am like
functional neurological
wearing a
disorder.
conversion
I
disorder
know we should
t-shirt.
probably switch over to that term, and I
Mm.
apologize if that is something that is considered to be kind of a not wanted
Okay.
term at this point for people who are suffering from the condition.
Yeah, great thought. Yeah, I hadn't really thought about it like that.
I wish I had remembered that
Yeah,
that part of the
yeah, of
statement as I was rereading it just now. I was like, damn it. But hey, we're learning as well.
course.
So how do you diagnose? So I think a big part of diagnosing this is kind of it. Well, first of all, it requires four of the following. You have one or more symptoms related to your brain's control over the movement or senses. Your
Yeah.
symptoms aren't consistent with recognized medical conditions. There's no explanation for your symptoms, such as another medical condition or mental health issue. And the symptoms or issues disrupt your life, especially your ability to work, have relationships, etc. So if you have those four criteria, you should move forward with trying to find diagnosis. Um, the word inconsistent in relationship to FNDS is really important,
Yeah.
meaning that the symptoms are inconsistent with medical testing. So as you're moving forward and getting medical testing, you're going to find that the symptoms, there's no correlation. You're not finding any medical reasoning for the symptoms you're experiencing. And then the doctors can start to rule out the medical conditions.
Yeah, you're gonna see a lot of doctors like holding papers up to the light and scans up to the light and saying like with a confused face, it's like something doesn't add up. They might
Right.
say that. They might
Sure.
say something that doesn't add up here.
Yeah.
Like that's kind of like what you're looking for, right?
Oh, I just it just dawned on me again, just way after the thought before. My patient whose father I mentioned had the conversion disorder, Parkinson's
Mm-hmm.
was the diagnosis he was convinced he had. So, and for a long time, it almost felt like he was seeking out the Parkinson's diagnosis, and he was ruled out every time that was sought out.
Yeah, because
So,
you'd probably hope in a sense, kind of being like that
providing
would
that
explain
comfort,
something. Yeah,
right,
that would
right,
explain it.
especially
It's almost like you're
if you're of an age where like these conditions aren't really known to you,
yeah.
it probably feels like, well, what else could it be?
It's almost like your brain turning on you or giving up on you. That sounds what that's more like what it feels like, right? Like your brain's like disengaging.
Yeah,
And
yeah,
that's like really scary to me.
yeah. So
Things like really looking into this stuff gets really scary. There's just so much that could happen. I mean, your body failing you because of stress around you. And they
right,
always say,
right.
like, I love this like little thing that people say all the time where just this whole idea that you can't control the things around you that happen. You can't control what happens outside of you, but you can, always have that opportunity to affect what happens inside of you, right? Make that change inside of you. But sometimes not. Which
Yeah.
that little like weird caveat is just kind of just throws the an unknown into all of that.
So one thing that I've seen some people experience, which I think is really interesting and also kind of shows some issues with the healthcare at times, is invalidation.
Yes.
And I don't know if you've witnessed this at all, Greg, but like what, for example, an individual that I work with who has the non-epileptic seizures. She has been hospitalized a number of times, and during her hospitalization, has actually heard hospital staff warn other hospital staff that she has fake seizures.
Yes, th that same thing happened to me. I wonder if where did they do like sometimes like inpatient in hospitals?
Yeah, yeah.
So look, we could be talking about the exact same person right now. I'm not even kidding you.
It was
So
prior to you working at the hospital,
okay, so but this is
and in multiple hospitals. This has
yeah,
happened.
so this happened recently, and I heard the nurse, like I don't know say anybody, you know what I mean? Like I heard the hospital staff saying this person does fake seizures, and like almost to the point where it's like, don't worry,
Yeah,
that
no, that's
person's on
exactly
the
what it
ground.
was.
Yeah, and it's like,
It's don't feed into it. Don't
yeah,
feed into it. Now imagine you're that patient.
uh-huh,
Imagine you're that person and you're at the hospital for whatever reason. It doesn't even have to be, it's, you're probably not there because of the seizures, right?
hmm,
Because if you have a seizure disorder, you don't necessarily go to a psychiatric hospital for a
no,
seizure disorder, right? You
no,
have other ways to get through that. So you're there for whatever reason, and then somebody who's supposed to be there to help you makes a comment that you fake seizures. That's if you want to talk about offensive, if you want to talk about feeling like people just view you poorly, like I couldn't even I felt so disappointed when they
yeah.
came back from their hospitalization and told and shared that with me. I was like kind of mortified, to be honest with you.
Like I to my like I did feel like I stepped in maybe over my bound. I don't know, but like saying something along the lines of like, well, maybe there's like an unexplained seizure. Maybe we're still trying to figure out why this person's having seizures.
Yeah.
Faking's like a difficult word. It's kind
I've
of a mess
seen
up.
people fake things before. I've
Yeah, no,
worked
that's the
in the
thing
field
too,
a
right?
long time. It's like I've seen it. I know what that looks like, but I also know when a person feels out of control. But even if the person was faking it, I would never say like you're faking it, stop it. I
Yeah,
would work with the person in a way that felt sensitive to if they're on the floor faking something, they're trying to tell me something.
that's
So
true too.
I'm going to try to work with them through whatever it is that's bothering them. So just even the fact that people can just, openly invalidate, but like that's a more obvious one. Now imagine you're a patient who is, having other symptoms, maybe less obvious, but you keep getting trying to go to the hospital to, seek answers. And I can only imagine some of the invalidation that must come at times during that process as they're trying to seek out doctors ruling out medical conditions.
So there's something that like comes to mind for me when we're talking about all this stuff, and it's the necessity of that thing we talked about with ACT, where it's like something, it kind of comes back to spirituality, where there's got to be something bigger than self, bigger than body, and bigger than mind that like we can always kind of anchor ourselves with, like something, some goal or some effort or some meaning that's like bigger than it all, where you say like, yeah, like this is happening to me, but I'm still this, and I'm still working towards this, and I'm
Mm-hmm.
still doing, you know what I mean? Like there's got to be there's just such I don't know how to frame it, but there's such an importance on like having something bigger than yourself, I think. Um Also, Dave, so what you're talking about here is like this idea that like, hey, maybe people are faking. You're not saying that. I'm just saying people in the hospital are saying this person who may or may not have conversion disorder is faking it, right?
Right.
So the idea that individuals with conversion disorder are faking the symptoms, it's the most harmful myth about this disorder. So ruling out all possible organic medical explanations is wildly important, of course, but differentiating between conversion disorder and other symptoms and maybe calling people malingers and saying they're faking it.
So, because
It's just not true.
here's the reason why this is so harmful
Yeah.
with this disorder.
Yes.
What would it mean if they were faking it? It would mean they were intentionally displaying the symptoms for a specific reason, maybe for some sort of
Like Munchausen.
manipulation.
Yeah, like Munchausen, it sounds like.
So if they were faking it, there's it's a form of manipulation, right?
Yeah.
Essentially, you're trying to elicit some kind of response from providers, from family, whoever. So right there, that's where this becomes dangerous by using the label faking any kind of symptom or disorder, right? So
Yes.
what we're saying is present in this disorder in actuality is the brain message that's causing the symptom.
Hmm.
It's not an intentional I want this kind of response, so this is what I'm going to demonstrate. It's the
Right.
brain actually telling the body I have this symptom, right?
Yeah. So we're talking about conversion disorder and how this is people,
FNDS,
right?
functional
FNDS.
neurological disorder.
You're right. And this is, what we're talking about is people who have enough conflict and stress in their life that they kind of reach this boiling over point, and like this psychological distress converts into severe physical symptoms, right? And there's always going to be something that you can pretty like that you can make that connection, like when we were saying with like medically this stuff doesn't add up, but trauma wise it does add up. So we're saying people are affected medically because of traumas in their lives, and when I would argue the most important thing or the most dangerous thing about saying they're faking it is by saying someone's faking it, you're adding trauma to their lives.
Sure.
You know what I mean? So it's
100%.
like by doing
100%.
that, you're worsening their symptoms and making them even worse,
Let
and this it's messed up.
let me share another way that this can sometimes inhibit someone from getting help. So that same individual who I just shared about with the non-epileptic seizures and the response the hospital staff were giving him, they were also at times trying to attend group therapy for various reasons. We're actually working on borderline personality disorder, and they would attend group therapy for this and midway through have a non-epileptic seizure mid group and be told that they could no longer continue group because they felt they weren't in a physical space where they could do it because of their non-epileptic seizure. So this happened almost every time they tried doing group. I think it's almost should be assumed that if you're in group therapy, there might be high levels of stress at some point during the group, and therefore the seizure might be a byproduct of that. If we're saying that this person's seizures tend to come on during high stress situations, but this happened so many times and was such a deterrent. I actually give the patient a lot of credit. She continued to try to locate
Yeah.
and find groups to participate in because she felt like it was really needed. But what a like it was so hard to like help this person through a lot of this because it's like every time we try to find an outlet for you to
Mhm.
to get help to work on this, we keep getting the same responses because of this.
So
So
over 80% of the people with conversion disorder, they stop working, they stop doing like
I
engaging, and like
can
you're saying,
understand.
they
Yeah,
stop participating in therapy, and it's like, what is this doing for their like symptoms? It's just making them worse and worse and worse. So
yeah.
it's like, what did this look like in your like when you were watching this in group? Had you seen a seizure before? Is this like something that's parallel to like medical seizure? What are we seeing?
So the ironic thing is I've never actually seen her have the seizure because was doing the one-to-one therapy and then sometimes
Ah,
would refer out
okay.
to groups. I got actually like referred her to the groups because they were sounded like they would be a great fit. And then it's like coming back, it's like, oh, I guess it wasn't such a great fit. That's wonderful.
So, you want to do another myth?
Yeah.
Here's one I think you might like. Uh, so there is this idea, or there was this idea for years and years and years that conversion disorder only affects women, and it was called, hysteria, which, is sort of the root word means wandering uterus is what hysteria means, which is kind of awful. But
Jeez.
I mean, this is like something that's been discounted over and over and over again, especially this was conversion disorder is big, big, big in war, in with veterans in World War One. They call it losing your nerve. They would call it like battle fatigue or like a lot of these things are like kind of commingled with PTSD. But I mean, PTSD is about like severe trauma. But in the moment, your body stops working. You go blind. That's not PTSD. That's not a symptom of PTSD. That's something wildly different. And so, it's it's pretty proportionate actually, the male versus female with conversion disorder. So that's just like a discounted thing for people.
So it's interesting though, because I did read another stat elsewhere that did say it is much more likely to happen in females.
Yeah, it's
Uh,
the same in the same way though, because I read that too. Like I have this stat where it says like 2 to 1, or even in some cases 10 to 1, which is wildly different and not
that's a
it can't.
very
Yeah.
broad range.
And then what do we know about um men when we talked about the things like this, like failure to report like symptoms and
Sure,
you
sure.
know, so it could
There's
just be a
probably
diagnostic thing.
absolutely. And the thing I was thinking was interesting was even though there's these ideas that it could be more common in women, majority of my experiences with it were males, except for
Yeah,
the
yeah,
one female that I brought up. So I just thought that was interesting. But also, I was like, well, as a male therapist, maybe we would be more likely to see other males with it
that's
because
true. That's a
we
good point.
tend to get other males in therapy and stuff. Not that we have only males, but
Not me.
yeah,
Like,
probably have more males than female therapists. I don't know.
yeah, maybe. Do males, can I ask you this? Like, this is just an aside because you brought it up. Speaking to a therapist, who would you rather speak to? Does it matter?
There was a period of time where I was like, I kind of want another male to talk to uh, because some of the things probably had to do with like topics that I felt I want to bounce off of another male. Like I
Yeah,
think at the
yeah.
time that I was looking for a therapist, I had that thought. Right now, I don't. If I were to talk to someone, I don't feel like the things I would want to talk about really would make a difference, male or
Yeah.
female. How about you?
I think, well, my experience is that I didn't ask for one or the other, but I got a mail, and I like that. I only see him once a month if I'm lucky, but I like the chats. I do. I find it like, and then it's actually been good for me in the way, and this is completely off topic, that like professionally it feels good for me because I go in there and I'm not really expecting like a lot from him. And I'm like, oh, good. I hopefully, people, because I always feel very pressured to almost perform. You know what I mean? To like have someone leave with something impactful. But sometimes people just need to let some stuff off their chest, and that's that.
Yeah, for sure. So
So,
also just along the lines of stats here,
okay.
this is also a very uncommon disorder, supposedly, even though
Yes.
we're kind of acknowledging that we've had experiences with it sounds like a decent amount of people. But I think the stats, you had a range of like, what was it like 22 per 100,000 people. And I had seen something that was like anywhere between 2 to 12 per 100,000 persons a year. So I mean, that's a pretty low ratio, but
Yeah.
at the same time, it makes me wonder if it's creeping up.
And just because of the stress or perceived stress is higher? What do you think?
I mean, I don't have the explanation for it.
Yeah.
Every time I offer an explanation, people tell me that I'm probably wrong. So I
Okay.
just think we're building awareness to things every day. I
Mm.
just think things that we brushed off or overlooked or minimized, or even like how many people talk about things now versus how much they used to talk about things previously.
For
I
better or for worse, I would say.
yeah, exactly. I think that today's society kind of almost allows itself to be diagnosed, right? Versus
Yeah.
everything was in the closet back in the day. Kids are
Like you
bragging
didn't
about
you
having a therapist. You know what I mean? So it's
That's
like
what I'm saying. Like you didn't want to be diagnosed back then. Now it seems like you do want to be diagnosed, which is a shift,
quite the
right?
shift. And
And then
I
that's,
know we
that's
both have our own like opinions about that,
yeah.
which we should probably not share
Yeah,
because
yeah.
I think well, and I think we could probably both find the pros and cons to that for
Sure,
sure.
absolutely. Yeah,
Yeah.
and because there are pros and cons, and that's just how it is.
Yeah.
And this isn't a new thing. This has been around for a really long time. I mean, there are literally records, which I find hysterical, dating back more than 2,000 years of conversion disorder. And now tell me how that works. I don't really know. I mean, it's historically it's known as hysteria, but some of
It
the
was
earliest
written in
surviving medical records.
hieroglyphics, right?
You know who wrote it down? You're gonna like this. Hippocrates.
Really?
The guy who, the Hippocratic Oath, the origins of hysteria to be described in like hieroglyphics, which you were right, they interpret them to sort of referring to conversion disorder. And Hippocrates is writing this stuff down, is wild. Like, I mean, and then for a little while in the Middle Ages, this is like demonic possession, of course, which makes, perfect sense that the witchcraft or whatever, like
Yeah.
something like that could be explaining it. But as we get into the later years, 17th, 18th, 19th, 20th century, we land on Freud and he kind of takes us the rest of the way
Now,
to almost to where we are now.
I was thinking about it, and it mainly because the individual who recommended this, and like kind of mentioned that the term conversion disorder has gotten to be a little bit of like a not so enjoyed term anymore,
Yeah.
and because of some of the correlation, and I believe you mentioned Freud's involvement. It's almost like anything Freud had an involvement in has turned into something that has a negative connotation
I know.
in
I know.
today's society,
I know.
which is unfortunate because it really does discredit the contributions he's made to the field. Whether you like him or not, he kind of paved the way for psychology in today's society.
Yeah. Sitting across from someone talking about their issues in a chair. I
Right.
mean,
It doesn't mean, and we could probably look at so many psychotherapists from previous times and look at their belief systems and say there's a lot wrong with it. Even the DSM-4 had things that
yeah.
every DSM changes, right?
We went to school. I almost want to say a first name, but I don't even think I should. But I might, and you can bleep it out if you want. We went to school with a guy
Don't
named
do it. I
Kyle,
don't
who
feel
I'm
like
worried
doing
about.
I didn't I hopefully I just talked over you and nobody hears that because I didn't feel like editing. Leap it out.
Let it be.
That's work, man.
Let's stay in, man. So listen,
Wait, what was
you
your
know what's
point to that
interesting?
one without saying his name?
Well, you were saying like, historical type psychotherapists may have been doing damage, and I said, well, even some non-hysteric
Oh
hysterical.
yeah. No one, luckily no one will know who we're talking about. But
Yeah.
I mean
Oh yeah.
that's the thing. When you go through your schooling, through your training, you're literally work like elbow to elbow with people who are like, how are you going to do this job?
Yes, I know. I'm not
Like, and
comfortable.
maybe they even look at us and say that, I'm
Maybe.
sure people, listeners probably are like, wow, these guys can do this. But no, there's some people that I'm like, literally like that. I don't know how you're talking to a person.
Yeah, I know. I remember. Yeah, trust me. So what's interesting, Dave, and again, kind of back to this point, a myth could be that, you're going to need medication to treat this thing, right? And because this is like a wildly dangerous, almost now we're hearing deadly disorder. But the reality is there's no like medication plays like no role in treating this. This is
Yeah.
all going to be like in our lane, which I find to be like,
Scary.
yes, and also cool. I just think like, CBT being you know, what would they even say? Like the chief something, like, the best, standard
Technique.
practice.
Yeah.
Yeah,
Standard
for
practice.
like treating your blindness. You know what I mean? Or
Right.
your paralysis. It's going to be some CBT. We're gonna chat about it.
And I think before, just from learning what I've learned and having some, experiences I've had in whatever capacity, the thing is if the person is not ready to process and work through some of the maybe the traumas or the experiences that have presented some of these symptoms,
Hmm.
I don't know that they'll be able to do that work. So it kind of comes back to that idea that like even no matter who you are, if you want to do therapy, you have to be in the place where you actually want to do therapy, right?
Yeah, no, so that, I mean, that's interesting because like part of it, like the CBT's piece of it, you're gonna be like discovering triggering events and perpetuating factors and risk factors and all these things and kind of, reframing and doing all that stuff. But when you talk about the people who are at risk for this, and that's not, this isn't, across the board, but it's like, so we're gonna say the female gender because that's just the stats, even though I'm not completely in agreement with that. Living in a rural area, lack of education, low socioeconomic status, being young, and a history of, like physical, sexual abuse and trauma. So, I mean, some of these suggest like, and I don't want to say this, like, is there like a lack of insight factor where it's like, um, is that play a role?
Like lack of education, we're saying, why are they saying that? Because they feel like if you have a lack of education, you might also have a lack of self-awareness.
Yeah, like it seems like kind of unfair to say that. Like,
I mean,
I
I
don't know.
don't know that you can necessarily say those two things to always be true, right?
Hmm.
But I
Yeah,
mean, it's a risk factor, so that doesn't mean it's always going to be the case. It's just
no.
a higher risk in those areas, is what they're saying.
Yeah.
So
Yeah.
before anyone gets totally offended by that statement,
Yeah,
so
no, because that's the thing, like I want to tiptoe around it. It's just like those are the risk factors listed in the DSM.
yeah,
So,
it says young age. I'm like also thinking about like if you're older in age, you have all these years of experience, but you're still susceptible to this, then there's probably some stuff going on that um you're probably lacking some self-awareness or some ability to
yeah.
process experiences, which would make you also at risk, I think.
So,
It's a
yeah,
lot.
that's interesting. And we got to be talking about some pretty big traumas here, right?
I would think, I mean, the few that I mentioned was like a traumatic injury, right? Or a traumatic event where someone was hurt. The other one
Hmm.
was like experiencing repeated grief, I guess, led to it. Um it would be interesting to hear some examples of other traumas that have led to it. But like you mentioned sexual and physical abuse
For
as
sure.
being
That's always a big one, right? Like it's,
yeah,
I mean, coming from someone you know and love who's supposed to be taking care of you and
sure.
to trust you. Um, it's tough. And this is one of those things where um it's such an unknown still. It is still one of those things where no one completely understands it and no one completely understands how to treat it. So I think that it's interesting that talk therapy is the only thing that can sort of pull you out of
but
it.
it makes sense because it's not a medical
Uh-huh.
condition. You've done your due diligence. And the other interesting thing to note is you really should be ruling out medical conditions anytime you're going to get
Anytime. Yeah.
help, because God forbid you have these symptoms and you assume that they're just due to stress.
Yeah.
It feels like everything's due to stress, right? But it's actually some medical condition that's happening that's actually causing it. You want to be able to catch things early on. So I always say, like, the first thing you should do is rule out medical conditions.
Hmm.
I can give a perfect example of this. I have this individual that I work with autism and nonverbal. He gets very overstimulated, but recently and like sometimes his behaviors will change. Like sometimes he might be more aggressive, sometimes he might get more property destruction. But recently he's been doing a lot of self-injurious behavior. So he's been like
Yeah.
punching himself in the head, and everybody's immediate reaction is to give him like an as needed medication, a PRN, to help him calm down. But I started to suggest to people before, like, even beyond that, why aren't we offering him like pain medication? He
Hmm.
could be communicating that he's got a headache and he doesn't know how to say it, right? And he's like banging his head. I've seen with nonverbal individuals, especially, like you see so many different kind of behaviors to express things that are going on. I had an individual who was nonverbal and started to like aggress towards us, got to the hospital, found out like after like a really like significant behavior, went to the hospital, turned out his shin was actually broken in two places. It was fractured in two places. So he was agitated and didn't know how to express what was going on. He was in significant pain. It came out
Frustration.
in something totally
Yeah.
unrelated to what the issue was. So like my mind has to like start to go there after some of these experiences I've had. But like we're so quick to always be like, oh, they're overstimulated, they're overwhelmed, they're, that we need to give them something to calm down. Well, also make sure there's nothing going on medically. You know what I mean?
Like take a step back and look at the bigger picture and be more open. And I have another perfect example of it too in fake world because I saw it on a TV show. This baby came in and was like completely freaking out, yelling, screaming, having a really hard time, and no one could figure it out. And then this one doctor comes in and like there's like a full examination, right? The baby's screaming, looking in the mouth, looking at the stomach, looking at all those things you would think of. And this other doctor comes in, does a full examination, and there's like a what's something called a hair tourniquet when like someone's hair gets
Ooh,
wrapped around something, the hair would wrapped around the pinky so tight that it was like causing excruciating pain. And
wow.
obviously, so it's like, yeah, when someone's like nonverbal, like a baby or a person who's, you really got to kind of do your due diligence and see like what is going on here,
Yeah.
you know,
Yep.
I think. So, I mean, yeah, I think this is an interesting thing. I think this is like it has historical significance. Maybe even like that dancing, what was there? Like a dancing. Was that mass hysteria like in like 1500s in like Germany or something where everyone just like danced and like people died from it? You remember? You don't remember
No,
hearing?
that sounds amazing.
Yeah, no, it's true story. Also, there's like laughing ones and like hiccups and that. If I wonder if this is all sort of connected in a way. Your brain's a powerful thing.
It is a
It's
powerful thing. And I think one of the biggest things, and I hope our use of conversion disorder, the term didn't kind of throw anyone off because um that's just kind of how we've known it, I guess, historically.
Yep.
So it kind of came second nature using that so frequently. But like the big thing I do want to like get across is if you're yourself experiencing symptoms of this disorder or you're working with someone with this disorder, like that invalidation piece I think is so huge. And I hope that we're able to, through this conversation we were able to bring some understanding that these are very real symptoms for the person experiencing them.
Hmm.
One of the things that was so bizarre to me when it was my first time ever experiencing this or hearing about this, and I was told that like the individual who couldn't walk actually went through physical therapy. So they treated it like with the normal, they
Yeah.
just kind of went through the motions almost of like how you would get someone to walk again, and then kind of utilizing like psychotherapy at the same time to help them kind of establish themselves back. So, but they treated it as if it was an actual, you know, medical condition they were experiencing. So it was super interesting. Um, but for that person, it was real.
Yeah, multi-pronged approach. I like that. There's this like last little tidbit here. There was this author, Donald Capps, who argued that Jesus healed people with conversion disorder, which kind of like is kind of cool to think about, right? People believed enough. So is that the key? You have to believe enough that this will work, or is that part of it? Like, I wonder, like having faith that the therapy or you could be healed. I mean, so
Interesting thought.
yeah, like faith being a component of it
Yeah.
is interesting as can be, I think, really.
Now
It's such a powerful
here's
tool
the
for us.
thing I want to ask you. Is
Okay.
belief is beliefs the same as like the messages our brain will send to our body? Can you believe in something enough for your brain to actually send the message to your body to make it happen?
I
Or
think
is
so.
that you think so, right?
I do. I
Okay.
do. I like we remember like that whole whether you think you can or think you can't, you're right. I really truly believe in that. Just because the our beliefs are stronger than even facts, and we've talked about that in the past, and it's hard to wrap your head around, but the things that we believe are just we see it in politics all the time. It doesn't matter. We could be shown a fact, but like we'll believe what like like what's in our heart,
Sure.
like you just like we talked about the other day when we watch a scary movie and then we see the actor out like somewhere just kind of being a normal person. We know that we've seen that actor in other scary movies. We know that's not really like what's going on with him. Our belief is more powerful. We still get scared. You know what I mean? It's weird. It's just yeah. And then I had my that friend of mine who thought they did really well in the SATs, but it was like a miscommunication, ended up like changing their whole lives, and they were like acted as if they were smart. So like just that attitude kind of got them further. You know, it's
So,
wild. Like beliefs are important too.
two things that just made me think of. Well, both in the lines of the non-epileptic seizures. So the first one was, I wonder if right before the person's like going to have the seizure, if they're thinking to themselves, I'm about to have a seizure. I'm
Yeah.
so stressed out. I'm about to have a seizure. Like, I wonder what the thought process is. And if it's kind of like what you're saying, like they believe it's going to happen. So their brain ends up sending the signal to their
Yeah.
body that
Strong
causes the
enough.
symptoms. And then the other thing was something along those lines. Uh oh, or in is it actually I wonder if it's a protective factor.
Uh-huh.
Like the brain doesn't feel the person can handle the stress that they're taking on,
Like a
so then
physical
it
dissociation.
it has that seizure as a way of like, let's end whatever the stress is, and now you're going into this
This will
because
do
this
it.
will end it.
That explains the blindness and the deafness too,
Sure. I don't
right?
know if it would. I'm sure that like someone could probably throw out another symptom and that maybe wouldn't fit this argument that we're making. But
The paralysis effect.
I almost feel like, yeah, it's a form of dissociation. Like it's the body, the brain is protecting the body
Yeah.
through this really maladaptive.
Or is the brain protecting the brain and saying, fuck the body?
Maybe it could be either one of those things, but
Yeah.
it's like what we would call a maladaptive coping skill, right? Is you're engaging in some sort of symptom
Yeah.
or behavior that maybe served a function or could serve a function in one experience, but like for the
Yeah.
most part, it's not something that would ever serve function in most
So
life
like it's
experiences.
an unintentional maladaptive coping strategy.
That's what I'm thinking.
Yeah. Dude,
It's interesting. It's an
works for
interesting
me.
thing. And again, to be honest with you, I think we'll probably learn more about this over the next few years as we continue our journeys and hear more experiences from people. So I guess I get one of the things I want to say is if you are someone who experiences FNDS and you want to share some of your experiences, either reach out to us on social media, especially like Instagram, or you can email us at utgnpodcast@gmail.com. And I'd love to hear more about people's experiences. And to
Yeah.
our listener who recommended this, Nico, thank you for this recommendation and kind of like sparking us to get motivated to do this one finally. It's been on the list probably for like a year and a half, I think.
Yeah.
So I
Been
appreciate
hanging
you
out.
kind of recommending it and us doing this. And hopefully we got this somewhat okay. I know this wasn't one that we have like a ton of experience working with, but hopefully this was kind of like an initiation into functional neurological disorder. Did I say that wrong? I think I did.
We're trying, Dave.
We're trying. Thanks. No, I got it right. It was functional neurological. I said it and I was like, is that wrong? Actually. um, okay. So yeah, that's it on my end. You got anything else,
But
Craig?
I think that ought to do it. Um, yeah, good one, I think, though. And, obviously, like you mentioned, we will do more to learn more about it. Um, Looking forward to it in a lot of ways. I think we'll start to see it more.
Possibly.
Uh-huh.
Uh-huh.
So, well, and that might make, hey, look, that's like serious work. So, we'll be ready for it. So, Dave, you have yourself a lovely evening, and I hope the listeners have a lovely evening as
Okay.
well.
All right, everybody. So as always, if you can, um, please leave a rating or review wherever you are listening. It's always appreciated. It helps us broaden our ability to reach different audiences and keep this bad boy going. Also, check out Apple subscriptions and Patreon. We started a Patreon for the page, and there is some perks if you are a subscriber on both of those. We have one bonus episode already in the books. We're going to have more coming up. So keep an eye out for those. And yeah, that should cover it. So we will see you next week for our St. Patrick's Day episode. Have a great night. We'll see you then. See you later.
See you later.
Bye-bye.